Vayod, please accept a token of our love and appreciation for what you did.
Thank you so much. Thank you. I'm really honored that Shetty sir is there as a chairperson for me, and I'm really honored to present my topic in front of all the experienced implantologists. I'm sure many of you must have placed a lot of implants. Implants से याद आया, how many of you think that your patient comes to you not for implant but for a teeth or a beautiful smile? Can you raise your hand? How many of you believe this? Only few? I can see only this part. Right? Yeah, fine, lovely. So you agree that patient comes to us not for implants, they come to us for a beautiful smile, beautiful teeth, and beautiful function, and of course a beautiful life. How many of you believe that if your treatment is having a direct impact in quality of life of the patient, they're going to give you more referral? Do you believe this? Have you experienced this? Lovely. And how many of you want to deliver a treatment plan and see such kind of a treatment results where patients will be achieving effectively and you will feel satisfaction? Right? So, I really thank ISOI committee and the organizing committee for inviting me to present on a special topic about improving the quality of life of the patient. For the reconstruction cases where there was an absolute atrophy of the jawbone and we delivered a high quality of life in such cases. So before we explain what is a high atrophy case, let me explain you what is abundant bone case. The abundant bone cases are the cases where there is a high amount of bone available in the anterior and the posterior part of the maxilla. We also, in both the jaws, when it comes to the water resorb cases, yes, the posterior segment is compromised because of the sinus expansion or because of the resorption in the posterior aspects of the mandible, but the anterior bone is quite decent enough. When it comes to severe bone, the anterior segment, even the posterior segment is devoid of the bone in height or width. This leads to a complicated treatment planning and many of the patients are now left out receiving the treatment plan. And what is high atrophy cases? These are those cases where absolutely bone is missing in either of the jawbone to receive a standard dental implant treatment. So there the options are left out to go into the more invasive treatment option. Now, coming to the efficacy of the treatment, we have done a study post-COVID era, more than 200 patients who are having absolutely compromised jawbones. There, we decided to do full nose implant reconstructions and we evaluated the efficacy of the treatment. What we checked was a true endpoint. What is true endpoint? These are nothing but a patient-centered outcome. How the treatment is going to have a direct effect on the quality of life of the patient. There are also other endpoints which called surrogate endpoints. This was fantastic. These are good. But they are more used for the research purpose like millimeter of bone loss examples. So this is a certain examples of the true endpoint and surrogate endpoints in dentistry. Well, you can see the lower one is nothing but the true and surrogate endpoints in dental implantology. Now, what we evaluated was oral health related quality of life. What we checked was we checked for the emotional aspect of the patient, whether they were happy, feeling before the treatment, whether they were happy, or they were unattractive. No, the emotional aspect we checked for the function, achieving function, speaking function, their health effect of the treatment or before the treatment, the effect on the health of the dental health as well as on the overall health, like digestion. We also check whether this kind of a disability has any direct effect on their social circle along with the friends or families. So we checked for that. What we found when we did a lot of full mouth reconstruction, there was a tremendous change in the emotional aspect, their social circle, the achieving function and their satisfaction post-treatment after 5 days, after 1 year and after 2 years of few cases. So, we also check for the disability and the discomfort of the patient. So blue indicates that was very high before the treatment, but post 1 year and 2 years, this disability and discomfort was drastically reduced in majority of the cases. So the cases were all done with the QuickTel system. This system has access to all single piece implants. And one of my favorite is the cortical TPR. This system has option of delivering screw-readed treatment plans. And of course, with the digital library, this also has a cross-channel device, which can be used for changing your access hole. The cortical TPR in this situation have a apical tip and of course aggressive threads. So it can be used like after the initial first pilot reaction, it can use for expansion of the bone. Now, let me show you this. If you see this, when the bone is very thin, and if you go into the standard design of an implant, there are chances we will have to do some kind of bone grafting. But when we are placing this kind of a design, it creates the bone expansion. So here the bone is expanding. Yeah. See, after a single drill, that is last drill, we placed this implant because the bone was very soft, and we could found that bone was decently expanded, and we still have a growth around the implants. Our main intention was to avoid any type of cantilever in either of the jaw, in a maxilla with the help of pterygoid implants, and in mandible with the help of either lingual cortical engagement or with the buccal bypass, which we do frequently to avoid any kind of cantilever. Now let me show you how is the pterygoid implants are placed. So with the pterygoid traverse it through the bone, and we will go and reach the second vertical bone of the pterygoid place. Once we hit it, we stop it. Either if the bone is very soft, we just tap it, or we take it out and we do the drilling. With the standard drilling protocols, we just go and perforate. After perforating, we take the probe, we measure, and after measurement, we check and we reduce the soft tissue thickness and decide the length of the implant, and slowly start placing the implants. When the bone is very giving us a high resistance, we go into a clockwise and anti-clockwise rotation. That's how we usually deliver the pterygoid placement, which you can see. Now, pterygoid placements are usually a flapless procedure. Very rarely you do it. If you don't perforate the pterygoid complex, sometimes you may not get the excellent engagement. So that's why it's very mandatory to check it with the probe. Now, let me show you a few cases of how we change the quality of life. Now, this patient, this gentleman, very young guy, 42-year age. His quality of life was compromised totally. His teething was affected, his eye was affected, low esteem, self-confidence, speech was affected. So many problems were there. This is the pre-op scan of the patient of left hand side, and then right hand side, absolutely less bone was there. Yes, our plan was to extract all the teeth, place the implants, engaging the second cortical, zygomatic bone, and also the pterygoids. In the lower jaw, we did the nerve bypass. On the buccal side, in the lower right, and left side, we did the lingual cortical engagement. Got a good job. That's a follow-up of the patient. We gave a light prosthesis. I don't believe in giving a zirconia prosthesis for such kind of cases or BFM, because this is nothing but this could act as another vertical cantilever for the patient. So that's why a lighter weight of prosthesis was given. This is a composite build prosthesis, and that's the result of the patient after the treatment. Okay, so what we found was his teething efficiency was tremendously improved, smile was very much improved, self-confidence was highly better, okay, speech was everything, was very good. Another case of a beautiful girl, very heart touching. She is just 19 years old, and she is not able to smile, her social life is totally hampered. If you, the bone is absolutely compromised in maxilla and mandible, so we left out with no other option other than going ahead with the zygomatic options, zygomatic placement, and we prefer in young patients to give something called screw retain process, so that this patient sometime in near future needs any kind of teeth replacements. It's always better to go ahead with the screw retain. You can just take out the process. We went ahead with the zygomatic implant placements and few placements through parietal approach of implant placement, and we delivered the prosthesis to the patient. This is a 1-year follow-up. Now this is day 1 versus day 5. Patient got told me, like, I have a desire to eat. She came actually from Ladakh. She said that I want to eat something. So she asked me, can I have a vada pav? So she is eating vada pav because she can eat and she can smile. That's the beautiful girl. And she can smile and her life is very happy. It's very easy to make people smile because that's our job. But it's more appealing if you make the smiles and if you get the smile out of tears of happiness. That's very important for us. And I usually work on this principle so that we get maximum out of the patients and we can get the best quality of life for the patient. Another case, this is again a 42 years old gentleman, same problem, similar kind of treatment problems, but his medical condition was not great. Even his financial was not great. So we decided to go ahead with some different type of approach where even this patient was needing zygomatic implant. So we decided, because there was no prominent zygoma, so we decided to go ahead with the intravenous approach of zygoma. This is a scan of the patient before after. We decided to go ahead with the flapless zygoma in upper arch with a single piece implants. Now here everything was flapless. In the lower jaw also we did majority areas except the mandible, everything was flapless, and we delivered the process. If you can see the lower jaw, it is splintered without metal frame. So what we experienced after certain maybe around 2 months or 3 months, we found that the process broke. That's why I always recommend go ahead with the process with the metal frame inside so that rigid fixation is there and you can avoid any kind of failures. So we took out this ailing implant. Following this is the follow-up of the patient. Now almost 4 years, patient is eating very well. You can hear to the patient.
इम्प्लांट होने के बाद अभी 4 साल के बाद मेरा वजन अभी 55 kg के आसपास हो गया। मैं अच्छी तरह से खा पी सकता हूँ और मेरा बॉडी लैंग्वेज भी अभी
Can you see the chubby cheeks, my friends?
अच्छी तरह से
From 42 to 56 kg. That's the victory. This is very important. If you can just give a dental implant and cannot change the people's life, that doesn't make any sense. So here, another lady, same kind of problem. Flunking processes. Because of this prolonged flunking process, there was a massive bone deficiency in the canine. Here it is technically impossible to place ample number of implants. Even the single piece implants are not possible in this kind of resolved cases because we have only 2 sides in anterior maxilla and one in the zygoma and one in the pterygoid region. So we can see there is a total deficiency of bone in premaxilla. So we decided to place 2 implants in the front and pterygoids and the zygoma. This is a 2-year follow-up of the patient. The process given to the patient. This is again a lightweight process. This is the smile of the patient. Now see what she achieved after the treatment was the attention from her husband. Can you relate what kind of problems patient can have? I think the ladies can relate to it. Am I right? Yeah. So she achieved the attention from her husband. That's very important. Oh, we may not think it because our job is just to give patient बस खत्म हो गया ऐसा नहीं है. There are so many things which affects the quality of life. So this is one thing. Another case of a teacher. She has undergone this treatment from some local dentist, and this screw was ailing badly. So we decided to take out this screw and we restored the case with the implants. This is the 2-year follow-up of the patient. Now this is the patient before and after the treatment, and now she is also eating the salads and sandwich, right? It's not easy because when the teeth are missing, majorly our diet shifts, our patient diet shifts to the softer side, and again these are all glycemic foods, the softer diets. Again this will affect this will shoot your blood sugar and so many things. The salads, the fibers, very important, and you need to have a teeth for that. So yes, our quality of life was improved a lot. A severe class 3 case. Again, the same situation, same set of problems every patient was facing. Resolved to place a very thin bone, if you can see. So here our approach was to place the implant on the parietal aspects. So we opened the flap, we placed the implant on the parietal aspect. So because the vertical TPR implant is having a polished collar ranging between 2 to around 3.5 millimeters at the crest, it is easy to place such kind of designs. Just like the zygoma which we have, the zygoma is also polished, so extra sinus zygoma or extra maxillary zygoma approach is of course very suitable. Now she is having a bizygomatic width which is very narrow, so we place in fact two zygomas, our zygoma is also reaching towards the close to the region of the orbit. Because the bizygomatic width is very narrow, it's not possible in these cases to place two zygomas. Okay, so this is the patient's before and after. You can see the class 3 also we got it edge to edge, and her aesthetics was best possible way we tried to achieve it to the best level. Another case, absolutely less bone, prolonged use of denture, absolutely less bone in the maxillary and mandible. Here we place the quad zygoma, but again, we never just give quad zygoma, we also avoid the cantilever with the pterygoid implants, and in the same way the lower jaw with the jaw bypass, and we delivered the patient beautiful smile. Even her life was very much improved post treatment. These are all 2 years of follow-up cases, and some cases where the jaw bypass is not possible in the mandibles. There the option is to go ahead with something called subperiosteal customized subperiosteal implants. Okay, so this patient, if you see the subperiosteal customized implants are given, and we give a screw retained option to this gentleman as well. He is also happy after receiving a fixed teeth. Yes, his quality of life was also improved. The case of a mucormycosis, gentlemen, this patient lost all his left side maxilla because of the severe mucormycosis. Now he was a priest. His main profession was chanting the mantras and Vedas and everywhere doing pujas. Now with this, his speech is totally gone. His life is gone. He said, I feel like dying. This is gone. Now, just listen to what he is saying.
अपराध हो गया, एक्सीडेंट हो गया, म्यूकोरमाइकोसिस का, पूरी जीने की आशा ही खो दी थी, लेकिन आज फिर वही।
Can you relate this speech now?
जैसा कि गोविंद ने कहा है कि जब भगवान की कृपा हो जाए, मुक्तम करोति वाचालं पंगुं लंघयते गिरिं यत्कृपातमहं वन्दे परमानंद माधवं। जब भगवान की कृपा हो जाए तो पंगु आदमी भी पहाड़ी पे चढ़ सकता है, मूका भी वाचाल या वेदांत का विवरण कर सकता है।
So what he means is, even a handicapped person can climb a mountain, and even deaf and dumb can read Vedas, and so this is very important. That's a determination to live is very important, and because of his determination, he achieved it. The best part, what we did on our part was we tried to maintain the position of the zygoma as close to the tooth position. We didn't give any extended, parental extended, because when we are doing a mucormycosis cases, there is no guideline for the tooth position. So you tend to come too much parentally or to tend to be too much on buccal side. So we tried to be best in the tooth position, the neutral zone, and that would, our intention was to improve the speech, and we achieved that. Okay, so another case, young boy, totally severely periodontally compromised dentition, pure vegan, lot of weight which has been lost, same problem. This is a 5 months follow-up. So he came recently. After 5 months he is saying 5 महीने में 5 किलो वजन बढ़ गया. Now he came recently. He is eating all those apples and everything. He came recently after 1.5 years. Now this is what he is saying. 10 kilo. See, in 1.5 years he gained almost 10 kgs. So that's a remarkable change. If we deliver a good treatment option to the patient, that's very important. Our treatment should be tangible to the patient's outcome. Now, this kind of treatment option is done by not me, but a lot of my students also. This is one of the workshop cases. This gentleman also doing excellently great. Another case which is done by our workshop doctors. where he is placing a zygoma, not me, or our doctors are placing the zygoma. So this kind of treatment option is also possible, and even you can treat such cases when there is absolutely atrophy jawbone cases, but with the right approach. Now these are certain cases, because of the shortage of time, I'm showing you certain cases, certain more cases. This is before and after of few more cases. Absolutely compromised bone. The lower case here, there was pterygomaxillary complex was totally fractured because the teeth were dilacerated, and extraction also it came to everything with the junction. Same way, upper and lower, all the cases. Here, absolutely thin bone in the lower jaw. Can you see? There is absolutely no way any kind of bone block grafting because the bone is just in the lower anterior. The bone is just 0.5 or 1 millimeter. So we go went ahead with the straight away with the standard one-piece implants. It is totally polished and placed on the palatal aspect, placed on the buccal aspect. Yeah, again the resolved cases. So my cases are always accessible on the Instagram, on my channel, Dr. Mayur. Thanks. Quick then, you can visit the stall 25 for this. With this, I would like to conclude. We are a dentist, we are a scientist, we are an artist. Patient comes to us for teeth, smile, beautiful life, new life, not just for implants. So our focus should be always be to the quality of life of the patient. And my forefather always said कि खाना खिलाना पुण्य का काम है. But I say खाना खिलाने लायक बनाना उससे भी पुण्य का काम है. And as an implantologist, we all of us will do that greatly. Thank you so much.